Good morning. It's 8 o'clock. And again, it's great to see you here at the intersection. Um, it's a beautiful morning and it's just a great way to start with all of you. Even my grandchildren know on Thursday morning, I've got this. It's Thursday morning, Gran. Are you talking to all your friends? Your friends. And of course, I have to say, yes, I am. So it's great to see you here. I'm excited about our time together today and who we're going to get to meet. I just checked in with her. I don't see her yet on screen with us. So
Hi, Anne, just joined.
there she is. There's Abigail. Yay. So Abigail, we usually take just a couple of announcements to let some people slide in these last couple minutes. When I sent out the notification yesterday, I included near the bottom of it that there's a webinar on this action guide that's a week from today. So that's one notice for upcoming, and Abigail will probably talk about it again later. Are there other announcements out there that people wish to share? Normally they're not this quiet, just so you know.
And
Yes.
yeah,
Go, Doug.
October 7th, San Antonio Zoo, the 14th annual NAMI walks. It's a great opportunity for people to come out and show their support for mental health care in our community. It's fun. Bring your family, bring your neighbor, bring the roommate from college that tied your shoes together. Everybody will have fun. So sign up. I put the link in the website. It's easy. So hope to see people out there.
Thanks, Doug. Martha Ann, did you want to talk a bit about the Nobel laureate coming to town?
Yes, mark October 4th. The first Indigenous person to get a Nobel Peace Prize, Rigoberta Menchú from Guatemala, will be at the University of the Incarnate Word, 6 to 8 in the evening. A wonderful opportunity to hear her and also to see some exhibits of various people like my students and I who are working in solidarity with the indigenous in Guatemala and Peru today. So I'll put in the chat the address where you can make reservations to hear this Nobel Prize winner, Rigoberta Menchú. We're having a book discussion, and if you would want to pop in the middle of it, you're really very welcome next Wednesday night at 7, either on Zoom or at our Sisters Center. So I'll put in all of that info. She's an inspiring woman.
Thank you, Martha Ann. I noticed some other things too that are in chat, and I encourage others to put things like this into chat, but I'm really encouraging everybody to take time to scroll through chat so you don't miss some of the things that are coming up.
And may I briefly just show a flyer?
Absolutely. The share screen is open.
Nope, it's not.
No, it's not. You're correct. It is now.
Thank you. This is an event called Sharing Hope, and it's for the African American and Latinx communities. It's a suicide prevention awareness event, and it's going to be really great. And the Ecumenical Center is speaking, as well as several other really important people. And it's at Second Baptist Church on Saturday, September 30th. Hope everybody can make it. The link is in chat. Thank you.
Oh, thank you. What a great event.
And it's free breakfast.
Free breakfast. Just show up for the free breakfast, right?
Yes.
Right. Any other last announcements? Okay, if you think of things, don't be afraid to put them in chat. So this morning, it's lots of fun to introduce you to a newer friend of mine, Abigail. And we have gotten to know each other over this project and research that's led to this action guide. And so it's just great fun to, and you know how all this works, all of you do with these community collaborations, kind of the benefits packages that you get to meet and know these amazing people doing amazing work in our city, across the country, and in other places. And so it's really great to have Abigail with us. And so thank you for being with us this morning, Abigail. What time is it where you are?
Well, thank you so much for having me, Anne, and it's nice to meet you all. It is 9:06 a.m. where I am. I'm based in New York City on the East Coast. I know it's a bit earlier for you all, so I was actually feeling a bit guilty. I'm already going for my second cup of coffee, so I maybe have a little more energy on everyone. But you can catch up. You can catch up.
That's right. So as you can see in her icon, she's with the Foundations for Social Connection. And they were one of the partners in this important project. Some of you may recall that this past May, the U.S. Surgeon General's office came out with an advisory on the epidemic of loneliness and isolation. And we're going to be hearing more about that next Thursday. Someone from the Surgeon General's office will be coming to talk about this. So you could say it's the cart before the horse, but it doesn't really work that way, right? Human lives are much more fluid and spiral than they are, loneliness. And then you've got to do what it takes to take care of that. It's a mixture of things. So that will be next week, and we'll hear more about that advisory. This action guide, which I want to share a screen too, helps us to move and organize into social connectivity. I wanted to share quickly. This is from one of the websites, one of the collaboratives, the Healing Collectively Collaborative here in San Antonio, pulled together. But in here are the real basic researched steps of how people heal as a community, as a collective. Safe practice spaces, listening, naming the pain, building relationships, notice what's happening in our bodies, breathing, togetherness, expressing what's inside and outside, and that being together is what creates community, and that love leans into growth, wisdom, and listening. These are, the basic research steps of how humans heal together. But what I think this action guide does is help us to figure out ways to come together and do that, right? In different communities as well. So first, Abigail, I want to ask, what cities were chosen to be a part of this? And why were they chosen? And San Antonio was one of those.
Sure. So in the process of developing this action guide, which I can share also, if folks want to take a look at the action guide itself, you can go and view it at action4connection.org. Though I do think probably once you look at it, you might tune out a little.
We're going to look at it. We're going to look around.
Yes. So we worked, we scheduled these convenings of different community leaders and change makers in 4 communities. Those 4 places were, of course, San Antonio with Anne collaborating with us, Atlanta, Georgia, and we worked with an organization there called The Same House to convene a conversation there. We went up to Bangor, Maine, which I had never been to Maine before, so that was exciting. And the last community that we collaborated with was Hennepin County, which is in the Minneapolis area in Minnesota. And we would have liked to do many, many, many more conversations because, as we know, there's so many things that are unique to different communities, their stories, the work that's already taking place. And we really came in with the ask to learn from different communities and leaders about what is social connection like in your community, and what are you doing, what's going well, what are you doing right, and where is there more opportunity for growth and in learning that, how can we develop a tool that will really support either work you have going on, reignite work that you have going on, or starting a new initiative, identifying gaps and places where you kind of realize, oh, you know, we've really focused on this area of bringing people together, but we haven't really, you know, addressed this particular community. So those are the 4 communities that we met with.
So tell us more about the action guide. And if you want to use the screen, feel free to do that. But tell us what's in this guide.
Absolutely. I will share my screen. I think it's helpful. I'm going to try to zoom through it. I have probably a few too many slides, but I hope it's a helpful tool to understand what the action guide is. I have a couple of slides about why social isolation and loneliness are so important, but I'm going to skip through those because I have a feeling whoever joins you from the Surgeon General's office next week will have even more to share in the advisory that the Surgeon General released earlier this year is tremendous and informed a lot of what we include in the guide as well. So if you're taking a look at that and you go and visit the guide, you're going to see a lot of shared themes, shared research, and I hope also alignment with these 6 pillars that the Surgeon General laid out to direct social connection work. And we really very much fall particularly into this first bucket through this action guide, but other things that we've included, hoping to support deepening knowledge, building cultures of connection. You'll kind of see all those things in the guide. This is a little bit about where this project stemmed from, which is we're a small nonprofit that is dedicated to advancing social connection and opportunities for all Americans to achieve social connection across society. But traditionally, when we think about particularly issues of social isolation and loneliness, which are part of the flip side of the coin of social connection, the social connection includes a lot of things just beyond addressing simply isolation and loneliness. A lot of the work is focused on individuals and less so on communities. We wanted to bridge the work that communities are already doing, the research that we have in social isolation and loneliness, and support communities to further advance social connection. And San Antonio is a community with so much wisdom that we came in to learn from because we're already doing so much work to advance social connection. So really, that's why we came to Anne. I don't think I answered your question about why those 4 communities. Each, we approached who are kind of have different focuses, the different people that we collaborated with in those communities are at kind of different stages of readiness in creating these community-wide initiatives and changes, in having collaborations across the community. Really wanted to offer something where more communities could build that. And the guide is organized into a 6-step process. This is very much inspired, and we talk about sort of who we drew inspiration from a lot of different action models for change, from different sources sort of in the public health world, local government engagement processes, community engagement processes. So we did not reinvent the wheel in kind of putting this together, but we really took the lens of how can social connection both be the ultimate goal of whatever a community does, we hope, with the action guide, but also in the process of doing so. And that's something that Anna has shared so much about and is so important, which is at the heart of making meaningful and effective social connection change are the relationships that build those, build that ultimate goal. And we organize into this 6-step process. We do not expect that all communities will simply follow in this like sequential way. That's not how real life works or real change works, but we put it together in the way we thought would make the most sense if one did want to go through sort of a chronological process, starting with learning, understanding the community, making sure that all perspectives are listened to and heard. And that's really important, especially think about things like social isolation, right? Who's being overlooked and is isolated in a community. That the reasons why some people feel isolated or disconnected from the community are different from others because of their identities, because of the history or the stories of a community. Then there is a process of building a coalition or a group or using an existing collaborative to kind of make a plan based on all of that learning. And then we offer some guidance on sort of once you take action, how can you track and measure your change? and then evaluate and share. And this is also important, not only I think for communities to be able to demonstrate effectiveness of programs and build support or course correct if things aren't working, but also because frankly, we need a lot more research and learning and knowledge. And we have tons of incredible case examples, including the work that's happening in San Antonio. But there's still a lot more that when we look at it for like this national level, there's still a lot more that needs to be captured and shared with other communities so that they know where to start. So these are a little bit more information on each of the steps of the guide. I think I'll probably skip through this a little bit because I think I kind of captured it at a high level what happens, but I do want to call out one thing, which is something we're really excited about, which is a county level data dashboard. You can see this in step 3 of the guide. We have a lot of steps in steps, but hopefully we've organized it in a way that's easily navigable, and we've made something that we have aimed to be really interactive and user-friendly, and that's really something we want feedback on. If you poke around and you find something is confusing to find, please tell us. And we want to adjust so it's really easy for people to use. We collaborated with an organization called IP3 that develops frameworks and data dashboards to provide, really, you can type in your zip code, you can find your county, and then generate this information on a county level. Some of the individual factors of social connection, unfortunately, are coming soon because they are not released on a county level yet, but we're really excited about that because this is among sort of like the first national data on perceived support and perceived isolation. It's sort of been intermittently included in national data sets. It's in 42 states with the BRFSS, which I'm forgetting what that acronym stands for. But we're working, our organization is working to really advance national surveillance. So we have more data on who is experiencing isolation and disconnection. Of course, then we can direct more resources to that. Some community social engagement factors, things like volunteering and participation in social associations, and then also thinking about policy systems and environmental factors that drive connection or disconnection. This is not an exhaustive list. We kind of had to narrow down to a list of 15, but we really wanted to provide something to support data-informed decision-making, and also hopefully something that's helpful, particularly at a county level. But we direct students, you can find this information on a local level, or you might be able to find this information on a national level. So that's a part of the process as well. And this is just a quick example of what's included on that. And like I mentioned, after you kind of do this assessment and talking to people, hosting a community listening session yourself, that's what we called the convening model that we did when we came to San Antonio with Anne and I think a few others on the call here. We then, invite users of these action steps to come together for a workshop, develop a vision, goals, a strategy, all the things needed to sort of make change a reality. And we also included in this, here we go, 20 promising strategies for community social connection, which is where compassion work is featured. We hope others will be inspired by this. And we offer different strategies that are both rooted in evidence and also have examples of communities and organizations that are already doing this work so others can learn from there. This is another place I'll just call out where we'd love more input about different examples that we can feature or different strategies that we've missed, because we know that a lot of people who come to our organization are looking for solutions, and we want to be able to offer as much as can be valuable for others. Of course, recognizing that every community is different and communities often already have the solutions, but to be able to augment that. And last but not least, I'll just say we have sort of the tenets of the guide, actionable content, so it's aimed to be practical and valuable. Things are very interactive. You kind of fill out exercises and tables and things in the action guide itself. We wanted everything to be able to be in one place. And then we've tried to think ahead of sort of when we planned a particular thing, like here's an email you could send out, here's a checklist you can use to prepare, like all those elements and details that really ensure the success of whether it's bringing together convening or mapping partners. We tried to kind of think ahead, anything that can be supportive of that process. And these are just some questions I'd love to leave you with, which is, I'm going to, of course, answer any questions anyone has, but how might you use the guide? What feedback might you be able to contribute throughout the guide? We have feedback forms. We are piloting this, right? We've learned with Anne, we've learned with other communities. We work with different researchers and, you know, different folks, but very much we're out here to test this and get feedback and learn how we can make this even better. And last but not least, who might you share the guide with? So that's an overview of the guide, and I'll quickly plug. I'll get the links to share. I can put the action guide link, and we do have, like Anne mentioned, a webinar next week. I know we talked about high level. We kind of go much more in depth on each of the different steps of the guide and how it might be used. And that's everything I have.
Oh, thank you. So yes, putting into chat where they can go and find the guide. The guide just came out, just like
Just
in
came
the
out.
last, just came out in the last week.
Mhm.
Ish. So where that is, if we can have that in chat, but you also mentioned that dashboard. Where do we find that?
Sure, and I can actually just share my screen and show you where to find it in the guide. So this is the action guide. Welcome. And yes, to answer, you're the first I'm presenting this to. We just released the guide on Monday. So long time coming, worked on it for about 8 months. So it was a long process to get here, but we're excited to be here. So this is what the action steps I was just talking about sort of look like. Click through here. You can also navigate to things through this journey path on the homepage. You can always come back to this to look at the different steps. In this community assessment step, you can click on review data and trends, scroll down a bit, and then type in your county. And then you can also open it up in a new tab, which is a little bit easier because we have a lot of information here. And you just type in your county and it generates the data when available. If the data isn't available, it'll kind of let you know that.
Can we go ahead and look at Bear County? I'll have to spell it for you.
Yeah, please do. Make sure I get this.
It's BEXAR. There it is.
Let me see, actually, if that didn't load, I'm going to do it again over here.
Put you on the spot, right?
No, good. It's testing the dashboard. I think I just saw a little.
These all look like, oh, are these all ours then?
These are all yours. Yes. Yes.
Wow. So then they're compared nationally.
And you can also compare them to your state as well. So county to state and county nationally.
Wow. I don't know the answer, Edward, to your question. Will the dashboard have a well-being measurement? I don't know.
Yes.
That question. Go ahead.
Hey, can you hear me, Ann?
Yes, I can, Edward.
I just have some technical issues with the headsets and so forth. Yeah, so the Social Connection has the link with Dr. Vanderweel at Harvard and his Flourishing program. You've got that conference coming up in October that's going to be talking about that. And it's a well-being measure that's an international one. It's got a couple $1 million, Templeton Foundation and others behind it. And it would be great if we could just have this comparative tool just to know how we're doing. It's also a measure that can be done even at the clinical level. And so we can understand where we are. And I guess my other question that I didn't put in the box is, are you going to engage the managed care organizations and healthcare and others for their role in social connection? Humana, Aetna, others have all talked about it. Some managed care plans are even buying people friends, having them call them weekly, try and keep them out of the hospital. I'm just curious where you see this going.
Sure. So to answer your first question, for now, we are not able to integrate this with other measures. However, I appreciate that you're calling out. It might be helpful even to direct people to other sources, right, to compare or contextualize this data with other data. So that's certainly something we could do. Down the road, we'd love to be able to either integrate or provide a lot more data. Right, to your point, this is not, if you think about the full like well-being measure, there are a lot of things that are not included on this list that would be included on that list. So I think that's a great call out. To your second question, yes, and we haven't thought yet about how we engage managed care organizations in terms of this action guide. But as an organization, we do work with different health insurers and health providers. So I should mention also, we have a sister organization called the Coalition to End Social Isolation and Loneliness that has about between 50 and 60 members, many of whom are in the healthcare space. We're a part of that coalition. So we do work with them. But I think that's a really great point about how this action guide can be used. It really would be dependent, I think, on the community. In some communities, managed care organizations could be a really fantastic partner in using this guide, or supporting a community in, taking the steps in this guide, whether it's providing funding or resources or connections or other things. So I think that's a really great idea. For others, that may be less of the direction that they kind of want to focus their social connection efforts. But I completely agree with you that managed care organizations, other healthcare organizations, often do and should play a big role in social connection focused work, particularly around isolation and loneliness.
Since you were talking too about partners, I mean, that's come up. There are other partners in this effort, Harvard being one of those. Can you say just a little bit about how the I think it's four partners, their roles in this action guide?
Yeah, absolutely. So the first organization to mention is the Einhorn Collaborative. They are a family foundation based in New York City, and they provided the support for this project, and they do fantastic work on social connection. They focus a lot of their work on like bridging and bonding, and they have a really fantastic primer on social connection that I recommend everyone checks out. We collaborated very closely with an organization called Healthy Places by Design. And you can find everyone's information and bios on the website. They were really our on-the-ground partner in developing the guide and hosting these conversations with communities and bringing the guide to life. And there also will be a big part, and you'll learn more about this next week and then beyond, in actually supporting communities and implementing the guide. They do a lot of technical assistance work and have a long history supporting public health and community change. And then the Harvard Human Flourishing Program was another partner in the guide. Ron Ivey, who's on their team, was another one of our sort of development partners in developing the guide, and other members of the Human Flourishing team provided some input and feedback on different portions of the guide. So we're the four organizations that have been a part of shaping this guide and will be a part of carrying it forward.
So thank you. It's 8:29 and I'm going to take a pause. To those who need to leave, in compassionate respect, thank you for being here, and it's okay to leave if you need to be moving on with your busy life. Thank you for being here. Next week, as I mentioned earlier, someone will be joining us from the U.S. Surgeon General's office. We could hope it might be him. Who knows? It might, but I'm not saying it will be. I don't know. But somebody will be joining us, and we'll be going more into the advisory that they came out with in May. Abigail, are you able to stay with us a few more minutes for those who want to continue the conversation? Great. Do we have any other comments or questions? Feel free to just jump in or raise your hand and we'll go about it that direction. Edward mentioned the October gathering. Maybe you could say a little bit. I'm wondering, Edward, if you're going, but Abigail, maybe you can say a little bit about that event.
Sure. I will do my best since I have not been as closely involved in shaping that, though other members of my team, of course, are. So in October, we'll be hosting our first in-person national conference on social connection called Building Connected Communities. And it sort of similar to the action guide will explore, but go much beyond the action guide. You know, sort of where are we now and how have we gotten here? What is the state of social connection nationally and in communities? And also explore solutions. And I know there's going to just be an amazing lineup of speakers, including the Surgeon General, including Dr. Julianne Holt-Lundstad, who is a phenomenal researcher on the topic of social connection, and lots of other sort of cultural thinkers and leaders and community members, and Anne will be there, which will be great. And I can put more information in the chat as well. I am not sure actually if there are any in-person spots open anymore, unfortunately. However, you can join and attend virtually. So I'll make sure to include that information in the chat.
Awesome. We could do that here. That would be great. Other thoughts? In fact, I invite thoughts of what do you hear in the action guide that you know about and see happening in San Antonio? Some of it, too, as I look at it, it reminds me of more community organizing, traditional community organizing. How do you bring people together? But there's a depth to this. It's like and that's what's so wonderful, right? That's kind of this evolutionary process that we're in terms of being human and understanding that, right? And then going deeper, and how do you bring community together, and how do you shape that, and how do you learn from it? And so I really appreciate, like where this is going and how it can inform us. I'm thinking about, pulling together, and I'm going to cough. I'm so sorry. I'm thinking about pulling together like maybe just a morning, like 4 hours, 3 hours or something, that folks here and others could come to, where we could explore the action guide and, apply it, tweak what we're doing on things we, start in different places, tweak what we're doing. And I'm really looking forward to the measurement tools as well. So Peter has his hand up.
Yes, thank you, Anne. Hello, Abigail. Peter Onofre with New Life Christian Center. Really liked the feedback that you posted from each of the meetings of the 4 cities or the 4 projects. And I was looking at just kind of perusing through them, and wanted to ask, I know, would you say it's unique in the way that we're structured with the city having a faith-based initiative that is really that connector for the nonprofits? Did you find that in the other cities? Would you say that was exceptional in the way that the work is done? Because I think it really lends itself well to that connectivity and being able to get insight on projects that are actually being implemented in the city and directly engaging in the process and just being very well connected. I think that's been a great benefit. And of course, applaud Anne and recognize her work in continuing to promote that and to connect us in such a great way. So that's my question, because I really like the way you posted it, and I love the way it's animated. I mean, it's beautiful.
Well, thank you. I'm glad to hear that. And yes, of the 4 communities that we met with, that this is the only structure like this that we're aware of. So I would say yes, absolutely. Though, in full transparency, I don't know about all communities, and it was only 4 communities, and we partner with specific people in communities. So I wouldn't be able to really give a non-biased sort of, higher level response to that. What I will say is that immediately when we started working with Anne on the project, and I think this speaks to what you're describing, Peter, is I think you had a pretty easy time. And we said, how could you bring different people together who bring different perspectives? It was like, oh, of course, right? It's like, well, how do I narrow down the list? Which in other communities, they had more of a challenge thinking kind of outside of the partners that they traditionally work with, whether, they're more, and this is one of the challenges with social connection work is it can get really siloed in an industry or like a sector, whatever you want to call it. When at the end of the day, we're all just people and we could do social connection work everywhere. We should, right? It shouldn't be just, oh, it's a healthcare problem or it's an education problem. So often it gets siloed. So immediately when we started to work with Anne, I could see there was already an infrastructure of bringing together different people who serve different parts of the community or bring different perspectives. And it was just to me, it seemed really organic to have all those different folks in the room. And I'm actually not sure what all of your all's seats are sort of where you sit, but I would imagine they're really different. And that's really unique and special and really important for social connection work so that you really take advantage of all the opportunities where people can meet each other and collaborate and support each other. So it's not just siloed.
Well, thank you. Great work.
One of the first compassionate cities in the United States, I think it was number 2, was Louisville, Kentucky. And the mayor emeritus from there, he just finished his last term at the end of last year. But he served 12 years, which is longer than our mayor will be able to do. But I've recently found out, and they did great work and are still doing great work in terms of compassion. So they're in one sense kind of the model that San Antonio followed, to have a mayor run on a completely compassionate platform and be reelected. And what does that look like? So, he was at it. Louisville was at it before San Antonio was. But all that said, recently I found out because I asked, did he, in that structure, the infrastructure, did they have someone who was connecting, that was on staff, or that was their job, right? And in fact, they had 2. And I'm trying to remember what the title was, but it did have compassion in the title. But they had 2 people, and he was just really frank. He said, it wouldn't have worked unless we had somebody every day who was intentionally working on the connections and thinking about it and moving in that direction. And I do know from other compassionate cities that there are many who have a person like that, but they're a very committed volunteer. Also not a bad thing. That's how we all know that's how it works. Just last night, I was on a call with Compassionate Australia. The 21st, today, is the International Day of World Peace. And so they have an event every year on this day. Just the 21st, was the next day. Anyway, and they were asking that question in terms of larger cities. How do you move this kind of collaborative coming together across a large city in particular? And Mayor Fisher from Louisville was there, and he said the only way you do it is if intentionally. You've got to have people working on this all the time, that they're focused on it, and they bring focus across the community, that it's a community. It was just great to hear him speak, because it was so, affirming. You've got to work with the community, and you've got to work with the civic structure. You've got to work with nonprofits. You've got to work with community groups, like we're all in this together, right? And that's the real theme I've been hearing this year. It was a theme for our mental health conference in August, Better Together. But I've been hearing that line in many different ways in our city, but also across the country. We're all in this together. We're better together. We need each other together, So there is kind of this, thread that we're hearing of togetherness, which speaks exactly to this work and what the Searching Journal too is lifting up. Other comments or questions? And I'll make sure that we find the link so that people can participate in the October event virtually from San Antonio. I'll make sure and get that out to people when I have it. Well, thank you all for coming. Thank you, Abigail, for starting your morning and second cup of coffee with us. I'm headed that direction right after this. Have great weekends. Next week, again, we're going to hear from the U.S. Surgeon General's office, and we're just going to be better together, and we're going to keep working that way. Thank you all. Appreciate your commitment, your work, your help, your friendship, your lives, your love, the compassion you share in the world. Oh, look at those smiles and the smiles that you gift us all with. Thank you.